Hello, everybody. As you're joining us for this session, we welcome you to our session today. And if you could please take a moment, use the chat feature, type in your name, the name of your organization, and even what state your organization is in. That would be great. We'd like to know who's out there, because this is a community. We'd love for you to participate too. Give that just a moment. We're straight up 12 o'clock Central Time, 11 o'clock Mountain Time. You are in the Nursing Home Quality Essentials session. August is Immunization Awareness Month. Raise awareness and improve your immunization program. Today is August 1st, the very first day of Awareness Month. My name is Mickey Raymond. I am a Senior Quality Improvement Facilitator. With me is Heather McDowell. She is our chat monitor today, and we thank you all for joining us. So we'll get started here, but before we begin, we want to be sure you all know about the QI Connect. Be sure and add that to your trusted email contacts. Many of you may have already done so, but we do share out information on upcoming events and special topics. We're also listed in social media on Facebook and LinkedIn, so be sure and follow us there as well. QI Connect, the Nursing Home Connect, is exclusively for your teams and nursing homes. Specifically, you'll get the notifications and updates from QIN-QIO that will include any CMS and CDC notes, also receiving information about trainings, events, but especially engaging in peer-to-peer sharing with other nursing home teams, where you can also ask questions, throw out interventions and strategies that are successful for you, and go from there and have that peer-to-peer contact. I'd also like to share with you too, Telligent's Nursing Home Assessment Dashboard, which has several assessments listed. We encourage you to take those assessments, look them over, look for any quality improvement opportunities. Going to today's session, August is Immunization Awareness Month. Raise awareness and improve your immunization program. The objectives for this session: describe required immunizations for nursing home residents, identify strategies for improving immunization programs, and also promote conversation tips to increase vaccine confidence. So now let's take a moment or two to hear from you all before we get started. There are letters there. For each letter, I'm going to read them out. If any of these apply to you, any or all, please put them into the chat feature so we can kind of get a feel for how our community is this morning. So letter A, type in letter A. My facility has a strong updated vaccination program for staff, residents, and patients for COVID-19 influenza pneumococcal vaccines. Type a letter B. My vaccination program has resources for having conversations and educating staff, residents, and patients on recommended vaccinations. The letter C. My facility has strategies for raising awareness about vaccinations and promoting activities to improve vaccination rates. A letter D for all of the above. And letter E. My facility could use some help strengthening our vaccination program. And as there are letters being typed in, Heather will read them, but if you have any questions, you can also reach out to us and we can support you with that. So I'm going to reach out.
In chat, Carla put A, Tammy put B, and thus far those are the only two responses.
That's okay. Thank you, Tammy and Carla.
Andrea put E, like Edward.
Okay. So we'll be sure, if you want, Andrea, you can type in if you want, or reach out to me or any of us and let us know. And on a one-to-one basis, we can support you or answer questions or help lead you in the direction that may be more supportive for you. Okay. National Immunization Awareness Month is August, as I said. It's also called NIAM for the code word for it, but it is an annual observance. It's held in August, every August. It highlights how important it is for routine vaccinations to be administered and accepted by all people, which we need throughout our life, from infancy all the way through our life. all adults need, and this is just for all adults, not exclusively to nursing home. COVID-19 current guidelines, the influenza vaccine every year, the TD or Tdap, which is tetanus, diphtheria. The P is pertussis, which is whooping cough, which is a serious, serious illness for those who are weakened, especially infants. Generally, that vaccine is given, I believe, at age 2 months. I could be incorrect, but some pediatricians are advising that adults may not be around infants, a family member, if they have not themselves had a recent Tdap, because there have been known cases of adults infected with pertussis or whooping cough, transmitting the infection to the infant and the infant becoming ill. Immunization regulations for long-term care residents. It is required. It is a law, actually. It's required that long-term care residents are offered, educated and offered any of these vaccines here. These three that are listed specifically is the influenza, which is the seasonal influenza, pneumococcal vaccines, and also the COVID-19 vaccines, right? So for those, especially for pneumococcal, it may be a little bit trickier, a little more challenging for those who are keeping track of the vaccines with them because there are some different guidelines depending on age, immunocompromising situations, if they've had a pneumococcal vaccine in the past. So I did put that link on the bottom of the slide here for you to click on it to help speed up your efforts of finding out and how to keep track of that if you need some support. There are deficiencies, deficiencies related to infection control regarding these three vaccinations. And if you do not have a procedure, if you don't have policies and procedures at all on them, or a way to get the vaccines, you don't have a specific plan, you don't have the timeline to offer, you will be cited at an F883. Also, a failure to demonstrate education in offering the vaccine to residents and staff. You'll receive an F887. So I do want to put that in there. They are citations. Communities are getting cited. And we know that specifically, we are healthcare providers and we are here to support our residents and patients so that if there is any healthcare items such as a vaccine or treatment plan that could help promote health for the resident, then we have to offer it. Whether we subscribe to that belief or not, we still are obligated to share that information with these residents and patients because we love them. Health factors. I've got these two side by side. Sometimes it can be tricky to differentiate between them. I've got another slide about it too. For influenza, so we know that anyone can become sick with the flu, right? Even us, even healthy people, and that serious problems related to flu, if you have an infection, are more serious among those who are at higher risk, such as 65 and older. If you're immunocompromised, they can really become ill. Also, those folks living in nursing home residents and patients. So if you're in a larger community with a lot of people around you every day, and I'll just add to even in the prison systems, anywhere where a large number of people are gathered, but we're talking about nursing homes. So they're at risk, higher risk than those in the community because they live in congregation together. COVID-19, so people who are up to date with their COVID vaccines are far less likely to die from COVID than those the same age who have not been vaccinated or who are not up to date on the COVID-19 vaccines. So those would be older adults with multiple underlying health conditions or people who are immunocompromised can still get very sick from COVID. What's the difference between influenza and the COVID-19 respiratory illness? Well, let's just break it down a little bit. We know that influenza and the flu and COVID-19, they're both respiratory illnesses. They're caused by different viruses, of course. You sometimes cannot tell the difference between flu and COVID-19 by the symptoms alone because some of the symptoms are the same. Some of the PCR, the nasal swab test, can differentiate between the two at the same time. So if you're being swabbed, it may be able to pull out the flu, what type of flu virus it is, and also the COVID-19 virus at the same time. So some of the symptoms that are the same, excuse me, are very similar are fever, chills, cough, shortness of breath, difficulty breathing, fatigue, extreme tiredness, a sore throat, a runny nose, a stuffy nose, those muscle aches, body aches, and headaches. And some of the differences would be, well, first of all, COVID-19 exclusively between the two or between the two, it can take them longer from the time of when they're infected with COVID-19 before they experience any of the symptoms first off. And so we know that with the influenza, generally it's a rapid onset, and the fever comes on quickly. You may not even have a fever with COVID, so that's a difference. You're contagious longer when you have a COVID infection, meaning you can go longer periods of time, not even know perhaps that you are infected with a COVID virus. Some people don't have any symptoms at all. Some have very mild symptoms, and we think that it's an allergy or other respiratory thing that's minor. So it can be very confusing. Recommendations for the fall 2024. So we know CDC's Advisory Committee on Immunization Practices, known as ACIP. This is their recommendation that individuals who are greater than 6 months of age or 6 months of age receive the 2024-2025 COVID vaccine when the doses become available. It's anticipated that they'll be available in September. That is the anticipated timeline. Just check back with CDC for further guidance on that. Who is at greater risk of serious infections? We know that we've talked about 65 years of age or older, which is a large percentage of our nursing home population. Those who are moderately or severely immunocompromised or with underlying medical conditions. If they're living in long-term care facilities, right? We talked about that. If they're of any age and they have never received a COVID vaccine, they're at higher risk. If you are pregnant or a pregnant woman, especially in late pregnancy, the third trimester, you're at greater risk of a serious COVID-19 infection. This is a really, really cool data tracker, or I think it's cool, so I'll just share that tidbit with you. This comes out weekly on Mondays. It's put out by the CDC. This slide here specifically came out, it was posted July 22nd. I also have this week's posting. I looked it up today to see the difference here. You can see on the left side there, COVID-19, the early indicators. First of all, you'd be testing. You'd be doing a nasal swab, most likely. The percent of positivity from last July of 23 to this July of 24 was 12.6%, right? So you can see on this graph here that it's tracking upward. You can see that it's got an upward tracking from July of 23 up to 24 here. Emergency department visits, right, for COVID, due to COVID is 1.6%. Again, we're measuring, have a year period of time from July of 23 to July 13th of 24. Then the severity indicators there, the hospitalizations, that would indicate a more severe case, an infection needing to be hospitalized. And this is the rates per 100,000 population. So we've got a 2.5. Again, it's increased from it's increasing the same kind of a trend from last July as of June 29th here of 24. The deaths here, that would be all deaths in the United States due to COVID-19 infection. Again, that's that year period of time, July of 23 to July of 24, specifically July 13th. At 0.9%. And just to let you know, a week later on the new data that I have here that I pulled, so as of the data through July 29th, or that was posted this past Monday, that the early indicators, more people testing positive for COVID, If you look back over on the left, where it was 12.6, it is now 14.3. So it's gradually increasing. The emergency department visits was 1.6%. It is now 1.9%. So again, it's just gradually increasing. Severity indicators, the hospitalizations was 2.5. It's now up to 2.9%. So again, it's trending upward. That's the trend. The deaths are 0.9%, and it's still a slight trend of upwards of 1.1%. So when we look at the trend here, we know that July is going to move into the fall, excuse me, and the winter, and there will be an increase as well. But here's the link at the bottom of this slide, and you can click on it weekly to see what the trends are, how it's going, and help you know what's out there. Healthcare settings and community awareness. So we know that the CDC's respiratory virus guidance, there's a snapshot there here on the slide. You could use it as an infographic if you like. You can click on that link at the bottom of the slide. It comes out each year, respiratory viruses, we know, in looking at the data slide I just shared, responsible for millions of illnesses, thousands of hospitalizations and deaths in the United States. The key here, though, is to reduce transmission, reduce chances of spreading the disease, right? We already know that. It started beginning of 2020. We were all wearing masks and we had those guidelines. So we know that the virus that causes COVID-19, there's other viruses too, the flu, also RSV, the respiratory syncytial virus. That's not required for nursing homes, but some practitioners and providers may recommend that your resident or staff receive one. And if they can, then you would offer that if you're able to. So what are some ways that we can help reduce the transmission, reduce the spread of these viruses? Immunizations, right? Okay, so vaccines. Here's hand hygiene. And we need to be, again, very stringent and aware of hand hygiene and do it. Steps for cleaner air. So like bringing in fresh outside air, purifying indoor air, gathering and meeting outside in the open air outside. Any treatment that's determined by the prescriber, stay at home if you're sick. Face masks, we still need to wear face masks. What makes sense? So when I know when state surveyors come on site and they're doing an infection prevention survey, you have an increased chance of receiving a citation for an infection prevention citation if your community is an outbreak or in your area that has a higher incidence of outbreak and you're not wearing a face mask. So we know that face masks do help prevent the spread of infections. You don't have to take my word for it. You can go on to any of the authorized sites like CDC and look at some of the tests where they share the lack of spread of germs when wearing a face mask properly. So we know social distancing is also important. Any of the respiratory tests like nasal swabs that can indicate and tell you if there's an infection, what the infection is. Awareness for healthcare professionals. Now, specifically here, there's several hyperlinks I wanted to point out to you. Things that you can learn or things that you can do are engaging in those learning courses with CDC's immunization and education trainings. Those are informative. Support and welcome questions. So if you're a resident, family, power of attorney, anyone is asking questions about the vaccine, take a moment and talk with them about it. If you don't know the answer, and you don't have to know the answer, but you can certainly tell them where to go to get the answer for sure. Use proven strategies here. This is going to help encourage residents and staff to stay up to date. This is also building vaccine confidence. This is a really, really good link, I believe, just because it has a lot of infographics in it and some really clear information and data about motivational interviewing, building that confidence, how to help engage with building trust among your staff and families and the residents too. And then also sharing clear and accurate information about the latest vaccine data. Now, promoting conversations. Let's talk about how can we get better at maybe in our conversations to engage folks to receive a vaccination. So understand your audience. First of all, who are they? What population are they from? Are they a part of? Are they staff? Are they residents? Are they families? What is their knowledge level of what's going on, what the vaccines are, what the viruses are? What are their perceptions, their beliefs, their motivations, barriers related to influenza, pneumococcal, and COVID vaccines? Keep up to date with vaccination guidance. I wanted to talk just a moment about this, and that CMS is making referrals to Telegen and the other QIN-QIOs, Quality Improvement Organization throughout the United States. If the threshold, CMS's threshold level of vaccines for up to date, let's say, is less than their threshold, they will reach out to us and we will reach out to you and see if there's some support or information we can offer to help improve your vaccination rates. One of the facilities that one of our facilitators reached out to, the corporate office was not aware of any of the updates of the COVID-19 vaccinations. And so therefore their nursing homes in the corporation were not up to date. And so one of the tips and intervention strategies is to perhaps get that identified person, designated person, an IP, infection preventionist, DON, or someone to make a note on alert on their calendar so that each month it may pop up something like check the CDC website just to see what the what any updates there may be there so that you can stay up to date and be in compliance. Explain the science behind vaccinations. If you've got reputable resources available online as well, Telegen offers them in different languages as well. Share the recently released guidance with COVID. So when the additional dose came out or an updated booster, be sure and share that information with everyone, residents, your staff. Here is the additional updated 23-24 COVID vaccine dose, which is still ongoing right now, currently. That was an update. And then there's even the updated information for the 24 and the 2025 COVID vaccine dose, soon to come around the corner. And then be open to conversations with staff, residents, and families. Just be open. Hear them, listen to them. Don't share your opinion, of course, but also share the resources with them and go over them if they need some support. Action steps for facilities, right? So prepare an immunization strategy. What is that? Well, that's a strategy where you're in compliance with state and federal regulations and requirements. You can identify a vaccination champion, the source of vaccines, like where will you order your vaccines from? Check doctor's orders if applicable, make sure your policies and procedures, your processes are in place, then educate and administer the vaccines, care coordination between hospitals, the doctor's offices, keeping in a track of those vaccinations when the resident comes back to you. And then also there's documentation in the state immunization information system that you should have access to that you can also check on. And then also utilizing Telegen's Adult Vaccine Toolkit. This link is there. Be open to conversations again. Be sure that you're there. That's a
Hey, Mickey, before you continue, we have a question in chat from Cindy Kemp.
yeah. Hi, Cindy.
When might COVID vaccine be FDA approved beyond emergency use?
That's a good question. I don't know the answer to that, but I'll find out. So if you are listed and you registered for this and you're Cindy, I can reach out to you unless anyone knows the answer. So you're asking about FDA approved for the upcoming vaccine. Is that correct? Did I understand your question? Do you mind to read it again, Heather?
Yeah,
Or
her
is
question was, when might COVID vaccine be FDA approved beyond emergency use?
Yeah, that's right. Very good question, Cindy. Okay. I'll get back with you whether I know the answer or not, and we will send you some information, okay? This resource here is a Vax Hub. It also has information resources on how to have conversations and talking, promoting vaccine confidence. I also want to point out the nursing home immunization escape room. Navigate through Teligent's nursing homes escape room and challenge your team. So you can register for it on the learning management system on our Teligent site. There's the link, the hyperlink there to do so. And as we wind down, you will receive these slides, I believe, on Friday, which is tomorrow. These are additional resources you can look at and study, ponder. Now I'm going to stop here with any questions, anything else that I might be able to support you with.
There are no questions in chat at the moment.
Okay, thank you, Heather. If you guys have questions in the future, please feel free to reach out to us. There's for general inquiries, my name and email there. You can reach out to your point of contact from Teligent. If you do not know who that person is, reach out to me. I'll find out for you and hook you up, and I can also support you as well to the very best of my ability. And I'll find someone who has the answer and get that answer out to you. We have upcoming nursing home quality essentials, and they happen every single Tuesday and every single Thursday for 30 minutes. So you can choose, you can go to all of them, attend all of them that you want. Next Tuesday, August 6th, we're going to have a speaker talk about Center of Excellence Behavioral Health, the website overview. Thursday next week, August 8th, Infection Prevention and Control, a leader's quest for improvement. And then the following Thursday, we have NHSN office hours. Teligent also has an NHSN subject matter expert. So if you would like some support for NHSN, reach out to us. We can hook you up with her. And I'd like to end it here just by saying thank you so much for many things. Thank you for working with our residents, our families, working with the staff, choosing to work in healthcare, supporting whatever role that you work. And we're grateful. Thank you very much. And have a wonderful day. And this concludes the session for today.